Proof that a happy wife means a happy life.
And a solution for a common issue many women don't want to talk about. We could talk about that one, though. CBS 2's Lisa Sigell is here now with today's Health Watch.
I know. And you shouldn't be embarrassed. Millions of women have trouble controlling their bladder. Now a group of doctors is releasing new guidelines to treat the condition without surgery. Shelley Goldberg suffers from urinary incontinence.
It seems that most of us hit middle age, and all of a sudden, it's just terrible.
The problem is very common. More than half of women between the ages of 40 to 60 and 3/4 of women 75 and older have trouble controlling their bladder. Now the American College of Physicians has new recommendations to treat the problem without surgery.
Kegel exercises, which strengthen the pelvic floor muscles, loss of weight, and doing bladder training. It's retraining the bladder to hold more urine so you don't have to go very frequently.
Doctors say medication may be recommended for some women. Research shows at least half of women struggling with the problem don't tell their doctor at all. Experts say women need to speak up to get the right treatment. Age, childbirth, and obesity can play a role, affecting pelvic muscles.
Ultimately, with time, with age, and their other risk factors, they weaken, so keeping them strong is the best way to prevent pelvic floor problems in general.
Shelley does her exercises 3 times a day and says it's making a difference.
It's a fact of life, it seems, but it doesn't have to be.
She says women should not be embarrassed and get help if they need it. And all those recommendations are based on 20 years of research. Also in Health Watch, more than 11 million antibiotic prescriptions given to kids every year may be unnecessary. A new study published in the journal Pediatrics says respiratory infections are the big culprit. In their findings, bacteria was present in only 30% of infections, but antibiotics were given almost 60% of the time. Now, antibiotics do not work, of course, on viruses like the flu. And finally on Health Watch, there may be some science behind that old saying, happy wife, happy life. New research from Rutgers University shows that the key to marital bliss is all about a woman's feelings. The happier they are, the better. The study's author says when a wife is satisfied, she tends to do more for her husband, which has a positive effect on his life. Now, researchers say the study is important because health and well-being can be impacted by marriage quality. So, happy wife, happy life, or I say just be happy.